Prior to being the director of supply chain operations and logistics at Queens, I was actually a project manager for our strategic planning department. And then prior to that, I did some Six Sigma Black Belt roles here at Queens in our operational excellence department. So I did both clinical performance improvement and then strategic planning prior to joining supply chain here. And then before Queens itself, before getting into healthcare, I was actually a aviation supply officer with the Marine Corps. So I served at Miles 24 here at Kaneohe Bay in Hawaii. The biggest reason why we went with BlueBin was to just reduce the amount of time that clinicians are spending in the supply chain process itself. And then, of course, to make our replenishment process much more efficient. So BlueBin the Kanban system in general solve both of those larger issues and streamline the supply chain replenishment process, right? Removing the clinicians on the front end and then helping us on the back end supply chain wise make that whole replenishment process more efficient. So, it's been night and day for, if you're an Omnicell user. I don't know if, you're a Pixis user, or even if you use PeopleSoft, the part count functionality itself, the concepts might seem simple, but really having the two-bin system, the way we replenish, and then how easy it is to scan and make those requisitions, it's a huge time saver, and it simplifies the process for your staff in how they reset their PARs and how they are able to communicate with them, being able to provide them the data that they need to make the supply node decisions that we made to bring these BlueBin nodes up live, in how they reset their PARs and how they are able to communicate with them, being able to provide them the data that they need to make the supply node decisions that we made to bring these BlueBin nodes up live in system, the way we replenish, and then how easy it is to scan and make those requisitions. It's a huge time saver, and it simplifies the process for your staff. The data you get on the back end is invaluable, and we can have these conversations with clinicians now, backed up by data that they can see, we can see. It's really a no-brainer. It's such a simple but elegant process and product, and the end user features of it, are really, it's really seamless. And Kanban was the way to go as far as a methodology, and obviously BlueBin kind of rises to the top of that. And anyone who's in the healthcare industry would know that you guys are at the top. But we looked at different options, but BlueBin was ultimately who we settled with. Really, from our management and supply management perspective, the Kanban system and the way BlueBin does it really took away all of the issues that we were having in terms of maintaining the system, right? The Omnicell required the clinicians to maintain the system in order for it to order accurately. And if they didn't maintain the system, then it would never replenish accurately, which means we'd have to, make ridiculously high PAR levels in order for it to order in the amounts that we wanted, in the event that the clinicians didn't pull the supply in the right way that they were supposed to. Kanban allowed that full reset, and then the simplicity of it, using the two bins is what makes it easier for the staff to visualize it and to see, right? I mean, the feedback has been so far, nothing but positive. They obviously enjoy the time back. They used to talk about how there used to be a waiting line at the Omnicells when they'd have to pull supplies, right? So lining up, waiting to log in, or if they jump into the room while supply chain's replenishing, then supply chain has to close the doors, sign out in order for the clinician to sign in. Our team has definitely realized on the front end greater engagement with our clinicians. So in how they reset their PARs and how they are able to communicate with them, being able to provide them the data that they need to make the supply node decisions that we made to bring these BlueBin nodes up live. That's very low maintenance on your end. So from that perspective, they just love it. They love having the system up. They love having it open. They love how clean it looks. So, the clear bins were a good feature. I think it brightens up the room itself. It's a very simple thing, but that's the beauty of it that I think has been beneficial for the staff. So.